A client with mysthenia gravis has been receiving neostigmine. What understanding of its action should the nurse have before administering this drug? Options: stimulates the cerebral cortex, blocks the action of cholinesterase, replaces deficient neurotransmitters, accelerate transmission along neural sheath. Answer: blocks the action of cholinesterase. Neostigmine is an anticholinesterase. It inhibits the breakdown of acetylcholine and thus prolonging the neurotransmission. So here the answer is blocks the action of cholinesterase. Which clinical indicator does the nurse expect a client with Parkinson's disease to exhibit? Options: flattened effect, muscle flaccidity, tonic-clonic seizures, a change in pain tolerance. Here the answer is flattened effect. This is because destruction of the neurons of the basal ganglia is Parkinson's disease. So this results in decreased muscle tone. The mask-like appearance and monotonous speech patterns can be interpreted as a flat effect. Okay, so here the answer is flattened effect. When helping a client with Parkinson's disease to ambulate, what instruction should the nurse give the client? Avoid leaning forward, hesitate between steps, rest when tremors are experienced, keep arms close to the center of gravity. Answer: avoid leaning forward. Because the client with Parkinson's disease often has a stooped posture. Okay, so because of this tendency of head and neck to be drawn down, this shift away from the center of support and causes instability. So we have to instruct that avoid leaning forward. A client with mysthenia gravis continues to become weaker despite treatment with neostigmine. The nurse understands that edrophonium hydrochloride, that is tensilon, is ordered to. Options: rule out cholinergic crisis, promote a synergistic effect, overcome neostigmine resistance, confirm the diagnosis of mysthenia. Here the answer is rule out the cholinergic crisis. Tensilon improves muscle strength in mysthenic crisis. So if the weakness is persist and if symptoms are caused by cholinergic crisis, the weakness persists, which can result from toxic levels of neostigmine. Okay, so in order to differentiate cholinergic crisis and mysthenic crisis, we use tensilon. So here the answer is to rule out cholinergic crisis. The nurse administers levodopa to a client with Parkinson's disease. Which therapeutic effect does the nurse expect the medication to produce? Options: increase in acetylcholine production, regeneration of injured thalamic cells, improvement in myelination of neurons, replacement of the neurotransmitter in the brain. So here the answer is replacement of neurotransmitter in the brain. So in Parkinson's disease, there is decrease in the dopamine. So levodopa replaces neurotransmitter dopamine in the brain. So our answer is replacement of neurotransmitter in the A client is diagnosed with Parkinson's disease and asks the nurse what causes the disease. On which underlying pathology does the nurse base a response? Options: disintegration of the myelin sheath, breakdown of the corpora quadrigemina, reduced acetylcholine receptors at synapses, degeneration of the neurons of the basal ganglia. Here the answer is degeneration of the neurons of the basal ganglia. Parkinson's diseases involves destruction of the neurons of the basal, and that is mainly because of the degeneration of the neurons of the basal ganglia. The cause of destruction is unknown. Okay, so here the answer is degeneration of the neurons of the basal ganglia. When interviewing a client with a tentative diagnosis of Parkinson's disease, the nurse expects the client to report the onset of symptoms occurred. Options: suddenly, overnight, gradually, irregularly. Here the answer is gradually. The onset of this disease is not sudden, that we know. So here the disease is gradual onset with a prolonged course. Okay, so here the answer is gradual. The nursing assistant brings a lunch tray to a client with a mysthenia gravis for whom bed rest has been prescribed. The nurse enters the room and identifies that the client is experiencing increased dysphagia. What should the nurse do first? Options: call the physician, administer oxygen, suction the trachea, raise the head of the bed. Answer: raise the head of the bed. While raising the head of the bed, it allows gravity to assist in the swallowing of saliva, food and fluid, so thus decreasing the chance for aspiration. So this should be done before the meal. So our answer is raise the head of the bed. A client with the diagnosis of Parkinson's disease asks the nurse, "Why do I drool so much?" Which is the nurse's best response? Options: we don't know why this happens. There is a paralysis of the throat muscles. You have a loss of involuntary movements. Muscle rigidity prevents normal swallowing. So here the option answer is you have a loss of involuntary movements. So this is the best response to the client's question, because the client with this disease cannot execute a automatic involuntary movements and has difficulty in swallowing saliva. Okay, so here the answer is you have a loss of involuntary movements. To what does the nurse attribute the increased risk of respiratory complications in clients with mysthenia gravis? Options: narrowed airways, impaired immunity, ineffective coughing, viscosity of secretions. Answer: ineffective coughing. This is because of the presence of weakened muscles. This weakened muscles results in ineffective coughing, and the secretions are retained and provide a medium for bacterial growth. So this causes again respiratory complications. So here the answer is ineffective coughing.